Good morning, welcome to PBL. Sit back and relax and enjoy this short topic and short film on the classification of The definition of vasculitis is inflammation within or around blood vessels with or without necrosis. Vasculitis syndromes are a group of relatively rare conditions whose etiology is still poorly understood, but is clearly multifactorial. Factors include ethnicity, genes, gender, environment, connective tissue disease. There are many types of vasculitis, so it is categorized into 4 categories. These are large arteries, medium arteries, small vessels and medium arteries, and small vessels. Starting with large arteries, there are 2 conditions. The first of these is giant cell arteritis, GCA. This is considered to be a condition within the spectrum of the more general condition called polymyalgia rheumatica, of which giant cell arteritis is the more severe form of the illness. Age at onset is 50 plus. And is twice as much more common in women. Clinical features include fatigue, headache, jaw claudication, loss of vision and scalp tenderness. The presence of giant cells in a biopsy of the temporal artery, and fever, night sweats, and jaw claudication. Early recognition can prevent blindness and other complications. The other condition in this category is Takayasu arteritis, which is most common in Asia and the peak onset is in the 30s. Now on to medium arteries. This contains, again, 2 conditions, starting with classical PAN, which stands for polyarteritis nodosa. This is uncommon in the UK and presents with tender subcutaneous nodules along the lines of arteries. This usually involves the skin, kidney, muscle nerve, and the GI tract. This can lead to an aneurysm formation and organ infarction. There is also Kawasaki disease. This predominantly affects children under 5 and presents with fever and polymorphous rash. The next category is small vessels and medium arteries. This contains 3 conditions, the first of which is Wegener's granulomatosis, and any organ may be involved. This includes mouth ulcers, otitis media, and CANCA positive in 90% of cases. The next condition is Churg-Strauss syndrome. This is associated with a history of allergy, for example in asthma. This is PANCA positive, and this includes microscopic polyangiitis. The next along is small vessels, and this is made up of 4 conditions again, the first of which is Henoch-Strodlein purpura. This is more common in children, has a purpuric rash, and includes an IgA deposition. This is acute and usually self-limiting. The next condition is hypersensitivity vasculitis, and then cryobulionemia, and then cutaneous leukocytoclastic angiitis. Under each of these categories, there are then secondary conditions associated with them. Going back to the first category, in large arteries, this is often associated with infections such as TB, or aortitis associated with RA. Then to medium arteries, and hepatitis B is often associated with PAN. The next category, small vessels and medium arteries, is often associated with infection again such as HIV, and vasculitis is secondary to RA, SLE or Sjogren's syndrome. And finally, the last of these is small vessels, and the secondary to these may be vasculitis, again secondary to RA, SLE and Sjogren's syndrome, drugs and hepatitis C associated infection.